to start, let me just ask you to introduce yourself, where you work, how long you've worked there, what you
Okay. Well, just kind of a brief history of my career. I, as a graduated from Kansas State University in 1992 with a degree in veterinary medicine, and made my way to Colorado via South Dakota. I'm currently the medical director for 2 veterinary emergency hospitals in the Greeley area, Greeley and Fort Collins area. We have about 75 employees at our hospitals, and we service all the area vets. We take all their emergencies after hours. So emergency critical care is our focus, and so that's where I'm at this point.
And you've spent years also in general practice, haven't you?
Most of my small animal, they call companion animal, small animal practice has been emergency critical care. I did spend about 10 years in a mixed practice prior to starting the emergency hospitals.
Mm-hmm. So the obvious question is, how has this pandemic, the COVID-19 pandemic, affected you and your practice and your patients?
Yeah, so like a lot of people, we've had to adjust how we do things across the board. So before having clients with patients come into the hospital, having that face-to-face contact with our clients while discussing and examining their pets has been the biggest change. We now do what we call curbside check-in or concierge service, where their pets are actually, we send somebody out, they take their pet, bring them in. All of our contact with the client is on the phone. So we're taking histories, talking about the client's concerns, and then doing all the financial stuff on the phone with the clients. So we've eliminated a lot of that face-to-face contact time. From that's just one perspective. It's really impacted us. The other perspective is, people have a lot more strain as far as, their finances, just because a lot of the people we're dealing with have been recently laid off from their jobs. So, we've seen an increase in the number of euthanasias that we do. We deal a lot with the human-animal bond. So, there's a huge impact not only to the owners, and their owner-pet relationship or human-animal bond, but also to our staff having to deal with that on a more frequent basis. In emergency medicine, veterinary emergency medicine, we deal with that a lot anyway, but it's even more than before, and it has a bigger impact on our staff because that's the only time we'll allow owner into the clinic, and they can only have two people come in with their pet if we're going to do euthanasia. So that directly is probably the biggest impacts. Secondary impacts are we're using the same medical supplies as they do in human medicine, clear down to anesthetic agents. I know in human medicine they use propofol, dexmedetomidine, phenobarb, oral phenobarb tablets, a lot for these people that are on ventilators. And, those are drugs we use a lot in veterinary medicine as well. So we've had shortages of those. So, we've had to cut back on procedures that we can do. Obviously, we aren't doing elective procedures. Fortunately, that doesn't affect us as much as it does a lot of practices. Mm-hmm. And then, just being short on supplies, just like everybody else, face mask, we've had to adapt, use more cloth. We do have we have a little more flexibility than they do in human medicine because, reusing supplies, re-sterilizing supplies, which now they're doing a lot in human medicine, something we routinely do. So we have a little more leeway than they do. But across the board, those are probably the biggest impacts. We are having to lay off some people. Across the board in our company, which is a national company, we're down 25%, which is pretty minimal compared to a lot of companies. Mm-hmm. That's 10% on the ER specialty services size. We're down 35% on the day practice type size, your general practices and stuff. So, mm-hmm. So they're seeing the impact, the biggest impact of it. So,
Are you
yes.
doing video stuff? Are you doing telemedicine?
There are a lot of the day practices that are doing telemedicine. We are doing more what I would say is phone consults. It doesn't work as well in emergency medicine for us because,
Yeah, what can you say?
and this is something I noticed in one of the echo talks is that, a lot of the human practices are doing some video chats and telemedicine, and, they're focused on the one disease specifically, but, you can get a better indication from talking to somebody on what's going on. But in our perspective, a vomiting, diarrhea dog, that's just symptoms it's just like in human. It can be so many different things, so it doesn't work really good in emergency medicine. Now, follow-ups, any type of follow-up, recheck for post-op type follow-ups, physical medicine type follow-ups, internal medicine type follow-ups. Yeah, those can be done pretty efficiently with some video chat and telemedicine. What we're ended up doing specifically in veterinary medicine on the emergency side is because they've lifted the restrictions for the veterinary client-patient relationship. We've been able to, talk to owners on the phone, establish, a pretty good idea of what the diagnosis is and prescribe meds where we don't have that actual physical contact with the vet. And we do that in cases like, a routine kennel cough that had exposure and, highly probable that that's the issue. So those type of scenarios, filling meds on a patient that we haven't seen in 6 months, which we typically won't do without an exam. We'll go ahead and fill those. So those are probably the most common scenarios where we actually use like a phone consult, not really specifically telemedicine. We did recently set up telemedicine. Some of the GPs are using it, and they're using it more routinely than we are in emergency medicine. So,
are you able to charge for those phone calls, video or not?
So if I do a phone consult with a person, no. If we use our telemedicine company, they charge prior to doing it. So and so this is probably going to be. This is a lot different than human medicine because I've done a phone telemedicine with my own doctor, and it was like $60. Our telemedicine consult's 180, and that's another reason we're not doing an emergency med because it's like double what they pay to come in, and it's like that doesn't fit. And socioeconomically in our area, it's like that's not going to work. People are going to do it. So that's a change we need to make in our industry. But yeah, just the fact that I do a phone consult or telemedicine and it's like double the price of actually coming in, I was like, that didn't make sense at all.
No.
So that's where we started. But yes, they do charge if it goes through telemedicine or televet, which is a company we use. If I'm just talking to people on the phone, no, typically not. So
well, it's only during this crisis that Medicare has agreed to pay for. I mean, my definition of telemedicine is just something that's done from a distance, using some kind of communication technology, which a telephone is. We've never been able to charge for that. And if your practice includes 2 hours of phone calls a day, that's always been unreimbursed. And it's also been a reason to bring patients in. It's rather than to take care of what you often could have taken care of on the phone. I mean, not that I've done that, but I that's one of the things that has skewed our system. And now that they're allowing physicians to charge kind of usual and customary fees for that, I think it's worked very, very well.
Well, I think that's true, Mark, and I think that's happened for years, especially in human general practices, and the veterinarians are just as good at giving away services and have been for years.
Yes.
We would do a lot of consultation on the phone, not charge anybody.
Yeah.
And that was one of the things that made the big switch to the emergency clinics. Two things happened. Our practice changed because more women went into veterinary medicine, and women are smarter and don't want to work 24/7. They're saying, and so, well, why don't we develop emergency hospitals? So they came about, and so when that change came about, then so did a lot of the talking to clients on the phone after hours, and then not asking them to come in because, oh well, it's just vomiting diarrhea. Well, that vomiting diarrhea might have been a patient needed to be seen because it's developed a GDV or something like that. And so from an emergency practice standpoint, we invite everybody in. That broken toenail, it's like, yeah, it's been bleeding for 4 hours or whatever. That's an emergency to that patient, that person. Whereas the dog with a twisted stomach, is obviously an emergency. It needs to be taken care of right away. And for years, we would see, when we first opened our emergency hospital, we'd see veterinarians say, well, we'll just check them in the morning, and then they'd show up at our place and their stomach's twisted, they need to go into emergency surgery. So, but and telemedicine is taking hold, and this is going to push it along quicker in veterinary medicine. But yeah, we're quite a ways behind the human medicine in that respect. But go ahead, Mark.
Well, I think it's on the way to becoming a commodity, in which case it's not going to cost $180 either. Exactly. You can probably do it way cheaper, although I assume your national organization, your national company has contracted with these people. But yeah, you can do it for nothing, or next to nothing.
Well, that's my contention, and that's where it's going to change, because the service that we pay charges us $120 a month, $5 a call. And our company came out and said, well, let's charge $180. I said, no, that ain't gonna work. I said, why don't we charge $45, half of our ER visit? And I said, and then my doctors are like, well, who's going to do this? The ER doc that's already busy on shift, or are we going to have somebody sitting at home doing these? And I said, well, we can't pay somebody to sit around home and do them at this point, but at some point in time, if you get busy enough, you could. So
right.
We're still trying to get our feet under us with that whole telemedicine thing. And once it happens, there's going to be veterinarians. Like already we have radiologists that are on online 24/7 reading radiographs.
Right.
And we also have pathologists that are reading, slides that we're making in practice and giving us a diagnosis over the phone within 2 hours. So we get a read on radiographs, we can get a read on cytology in less than 2 hours, any time of the day, 24/7. And that'll happen with telemedicine.
Well, in my experience with telemedicine and as a generalist, as a family doctor, sometimes there's something really to show, whether it's an eardrum with an otoscope, or a skin lesion, or whatever it is. There's really something to show, and there's a good reason to have. There's really good reason to have the video. But the main thing that it does is it helps to establish rapport. It's better than a phone conversation in that way. But it doesn't really add that much. Most of the time that you're not getting over the phone anyway.
Yeah.
So
and that's true. And the interesting thing is, like if I'm talking to you because of my symptoms, we're face to face. I'm talking to a person about their animal. The dog's running around. They're chasing it.
That's right.
They're chasing around with the camera. And if it has a cough, you can say, "Yep, I can hear that." So. Yeah. Or, if it's really sick and it's just laying there not moving and it's cyanotic, it's like, okay, that one needs to come in right away. But,
I can see that.
So, but telemedicine is one of the areas that I think is going to be pushed forward a lot quicker because of the whole pandemic. The other areas that, we're seeing, not a lot, but several of the day practices have completely closed. So we've actually seen an uptick in the number of emergency cases. There's also a lot of practices that didn't stop doing non-essential type surgeries because their justification is that spay and neuter is essential, because if the patient gets bred, then it does this or that, or there was a lot of gray area in that. It's like, is this essential surgery? Is it not?
Well, the Supreme Court in Texas just ruled that it isn't.
Did they?
For people.
Oh yeah, for people. Yeah.
Yeah.
But that's the thing I've been hearing on the human side of things is, they're having to lay people off in human medicine because they're not doing,
Right.
what they consider non-essential surgery. And I'm just like, man, that's a big deal. And, I don't think we've begun to feel the effects of all the layoffs. And, especially like in our county where there's a lot of oil and gas and those people are getting laid off. Our clinic that's in that county specifically has seen a huge surge in people's ability to pay and do more for their pets because of the oil and gas industry. And I think unless that comes roaring back, which there's no indication it's gonna with the price of oil, we're gonna see a huge change. And we are looking at some more extensive cuts in staffing, kind of getting down to absolute essential personnel. So if you're not working a shift, you're on the line. And I know a lot of other companies have done that already. And, we're in a pretty recession-proof profession in veterinary medicine, emergency medicine. People will put off their vaccines and spays and neuters, but when the dog's having diarrhea or bleeding, they're coming in to see you. So
That's right.
We didn't have much impact the last time we had a recession, and it's yet to be seen what's going to happen this time around. But, it's kind of a crazy thing because, we had the state was reaching out to us for personal protective equipment. They also are reaching out for us, to see if they could use our ventilators because we're using a mechanical ventilator that is for surgery. It's not essentially a critical care ventilator or patient driven.
Mm-hmm.
So you could use it with humans. I know some clinics like CSU had one of the top of the line human ventilators. But mostly what we're using is something that it's a surgical ventilator that you're going to use in surgery and not the higher end. Yeah. So we also have a bird ventilator that we built. That's a patient assist type ventilator, and you could use it in human medicine. They probably wouldn't because they'd say, "What the heck is that?"
I'd love to see it.
Oh yeah, it's awesome. They call it a bag and a barrel. So it's just a ambu bag inside a big, plastic, clear plastic barrel, and it's and then it's got a bird on the outside. So it's just driven by the bird. The patient starts the breath and then it kicks in and does it. And so we can ventilate long term for that. But that's the ingenuity you get in veterinary medicine. It's like, we want one of these, but we're not going to pay this price,
So it sounds like an iron lung, that it actually produces negative pressure on the chest from the outside, and that's
no. It actually has a ambu bag inside a plastic container, and then it produces negative positive pressure outside the ambu bag to drive the breath of the patient. And then the bird is the triggering mechanism. So you got the bird ventilator on the outside. So it's not, the patient's not in there. The patient has a trach tube in, just like a normal.
I see.
Gas anesthesia.
And a trach tube must be about that big.
Depending on the patient, yeah, we get down to probably 8 or 10 French, and then we go clear up to for the larger canine patients, they're probably about the same as a human, as far as size. We're using all those tubes we're using are made for humans. So, except for the little bitty ones that we put in ferrets and stuff. So,
have you been able to have you given any supplies or equipment to the medical system?
So we have made lists, and those lists have been turned into the state, and they haven't asked for anything. The issue is that we run into a lot of the stuff we have is partially open, and I think what we have that's not partially opened is, not enough volume for them to even worry about it. I know some of the day general practices that aren't doing ER have given a lot of equipment, and like surgical gowns, we're not using disposable gowns at all. Everything's cloth. Our mask, we're using cloth mask. We've had some made by people for our staff, and so we've gone pretty much to all cloth on that. We've pretty much cut back on everything. We still get exam gloves, and we have So in our industry, they said, okay, if you ordered 10 boxes of a large exam gloves last year, that's your allocation for this year. And they haven't cut that off. Now, we just got notification that propofol, dexmedetomidine, and phenobarb, and a couple other drugs that we use routinely are going to go on back order short supply because it's all going to human medicine. So, in our industry, we use a lot of human products, but we have the availability to switch back over to some veterinary products. But, it's just like with human patients, the best product may be a human product for our patient. And so we have the extra label usage, but, we have to make adjustments all the time because like we just went through with all the opioid stuff going on. We've had to switch from fentanyl to hydro, and then that's not there. We got methadone, so we're switching all around trying to find products to use on our patients for, CRIs and stuff like that. I don't think most people realize that how advanced veterinary practice is, from where we were, especially even like from when I got out of school.
Right.
The things that we're doing are right at the same level as what they're doing in your human hospital.
Sure.
We're ventilating patients and all that, and we're seeing, and the interesting thing, the things they're seeing with coronavirus in cats, and I had a whole household of cats the other day, and 2 of our labs will test for coronavirus, the actual COVID, because we deal with coronavirus all the time. A lot of our patients get coronavirus in different forms. And we deal with a lot of infectious disease all the time. We're probably once a year, we have a patient that comes in who has plague, either bubonic or pneumonic plague. We've had a couple of pneumonic plagues where we've had multiple staff members, that got exposed. So that's always on our radar, especially at our Fort Collins facility. And then lepto, we had a lepto case the other day, which is a zoonotic. And tularemia, we see that frequently. So we deal with some bad bugs, and we do a lot with MRSA like they do on the human side of thing. So, just like I think in human ERs where you're seeing the worst of the worst, that's kind of what we see and have to counsel people to go see their human doctor because their dog has lepto. And they've been exposed to it, or their cat has the plague, and your whole family may have been exposed to it, and and rabies. That's pretty routine. It's on the uptick in Colorado now because we hadn't had to deal with that for years. But just overall, I think our industry, like the human medical industry, is feeling the impact of this social distancing because veterinarians are generally people too. They really like working with people and love animals on top of that. And I think when you lose that contact, I know I miss that time where I'm talking with people in the room face to face and discussing what's going on with their pet. And that's been a big impact on a lot of my staff. I have some staff that are just deathly afraid of catching this, and we've had more hand washing, and everybody completely sterilizes their station. So we assign each doctor and each technician has their own workstation. It's your responsibility when you leave. You spray it down with Lysol and let it set before the next person comes on board. And then your chair, everything that you think that you've touched, and then the techs are going around cleaning all the time anyway. Probably the biggest risk we have is a patient that comes in from a household that had a lot of coronavirus going on. Is a possibility of a fomite, bringing it into our hospital. But fortunately, we haven't had any of that. We've had a couple employees that have had to be quarantined because they got exposed to a family member. We had one yesterday that lost a grandparent here in Greeley. So, we haven't had the impact of a lot of people, but it's always in the background, just like for everybody else.
Yes. So how is morale among your staff? Pardon me.
That's the area that is really fluctuating, and it's day to day, and I think it has to do partially with what's coming out on the news as to, we're going to open up 50%, or that they're going to mandate that we stay closed for this period of time. And, it's up and down. And, if you get bad news about somebody in your hospital that has been exposed and they're going to be out for 14 days, then, we have to shift the whole schedule to make up for their loss, that they're not going to be around. That's having a big impact. Our industry had a pretty prominent veterinarian a year ago, a little over a year ago, commit suicide. And it was probably one of the most prominent teaching veterinarians to, have that happen to. And we have had to do a lot with, helping people through that whole scenario. But then also, our industry across the board has had an increase in suicide. So, we're really trying to stay on top of that, and it is a big concern. And we try to really watch people. We have resources through our company where people can reach out and assist the employee assistance program. If they have any needs. We encourage our own staff to watch out after each other, bring to management's attention if they're seeing any issues. At this point, we haven't seen anything, but we're kind of in the heat of things, and I think as things start to calm down, get back to normal, and people look at where they're at financially, I'm concerned that we're going to see an increase in some of that, because I think when you're in the heat of battle, everybody's like, okay, everybody's hunkered down, and then when people come out the other side, and it's like, okay, now, I had one employee that was really stressed because they were trying to figure out how they were going to pay their rent, and because they were losing some income because they were going to doggy sit for people that are no longer going out of town as extra income. And then their landlord said, I have to pay rent for 3 months. But, at the end of 3 months, when that kicks back in and they have to start paying rent, how's that all going to come out in the wash? And where's that employee going to be? And our company's made restrictions on, just simple things like buying, snacks and stuff as a clinic, and little things that don't seem like they mean much. And so as a group, we've had doctors and managers step up and fill in and buy those things, even though the company's not paying for them as a whole. So those are things that have a bigger impact than you realize. And trying to keep staff morale up, having your chocolate drawer full is a big deal, especially when you're under a lot more stress.
And that's a drug that's not in short supply, I understand.
Exactly. There's plenty out there, although I did order some from Amazon. It took 2 weeks to get there. I was like, so, it is something that is beneficial, and it's just the little things we found that we can do. But, our big concern, and I think we're going to, we've seen some furloughs higher up in the company and definitely in some of the day practices, but we're probably going to have to do some of that on the local level, which is a concern. And you try to have as minimal impact on all the staff, but there's no way to predict what the ripple effects are going to be of laying people off. So it's hard.
How do you, when all is said and done, and who knows when that's going to be, how will veterinary medicine have changed?
Yeah, I think some of the obvious things, I think telemedicine will be one. Are they going to continue to have a decreased or relaxed veterinary client-patient relationship? That may be one. I think from client standpoints, they may find that some of the stuff that we do routinely isn't essential. When you come right down to it, pets are a luxury. And, we are at a point in our country where pets are part of people's family. But when you go through something like this and people say, well, my pet's really a luxury, I got people in my family that are affected and dying from this type of thing. I'm not going to take my pet and get them spayed or neutered. And it may change some people's perspective on, the value of their pet and that, relationship that they have. There's been a big push the other way in this country to make pets companion. And I know from our perspective as veterinarians, there's a lot of discussion of whether that's a good thing or bad thing. I think it's great to have pets, think of them as companions, but from when you start looking at insurance and what the cost of insurance is if a pet is a companion, because then you get into a whole different ball game. Instead of somebody lost a pet and they can sue for the value of a pet, now they can sue for pain and suffering and all those things. So from our perspective, from an insurance perspective, purely, that's going to be a huge expense on our side. But my big concern is, how is it going to affect our clients going forward? And are they going to look at pets more of a luxury and stop doing as much as they routinely do? Client visits were down at the end of last year across our company for whatever reason, because the economy was doing really well. Last year in the summer we were down. Our company wasn't, but it was down. But we were up early 2020. So it fluctuates, and anytime you have this type of impact, it has to do with how long-lived this is going to be. If we see an abrupt turnaround, which hopefully we will, things may get back on track pretty quick. But I don't know. You got to kind of hunker down and say, all right, let's prepare for the worst and hope for the best, like always. So,
yeah, we're still. What's the date today? The 23rd, 4th, something like that. See, I'm losing track.
24th is today.
Yeah, that says something too. Is that I just don't know that. But it's still early in this process that we're having this conversation.
Yeah, it was 23rd of last month. I think they shut everything down.
Yeah,
so it's been just a month. It's like feels like it's been 3 years.
Doesn't it? Yes.
It does. And it's like, oh my gosh, it's like, how many years are we into this thing?
Right. And I assume that aside from going to work, you're not doing much outside. Maybe going out for a drive or.
Yeah.
But otherwise, you're home.
Yeah, and that's true. And our son was over college for several weeks. He lives off campus, so he's able to go back up. He's doing online classes, and our impact, because we're outside of town, we still get out and do a lot, and is little. We feel blessed and fortunate because of that. But I know I have employees that have little kids at home. They're trying to homeschool them and do online meetings, and and then go to work and do their work, and who's taking care of the kids while I'm at work because daycare shut down, and there's just so many things that people are dealing with. And so we got one son that's up at college, and he's hunkered down doing online classes, and I have another one that's been in his apartment for 3 weeks, and fortunately he's just working from home for his job. And just like everybody, it's all those changes. We count our blessing just because the position we're in, where we're located, we can get out and work in the yard and do our stuff. But I really feel for people in town that don't have those luxuries, and and that's the thing. Where's the best place to help? And you try to find people that you can help out locally. It's like usually you're looking at, okay, how can I help people around the world on a grand scale? But now it's like, who can I help out just like in my circle of people right next to me, because those people are hurting and need help now. And before it was like, how do I help people in Africa, or how do I help people in South America? Now it's like, gosh, I need to help people right here, and the people in Africa still need help.
Right.
We've lost how many people from coronavirus around the world, but 8,000 kids starve to death in the world a day.
Yeah.
And it's like, we need to probably keep some things in perspective. It's like, why weren't we doing more there? We got an excess of food, and there's people starving. And so that can get into a whole nother discussion.
Well, I hope we get to do that in the future before not recorded, just have it.
Yeah,
absolutely. Yeah. Well, anything else you'd like to say, or anything you want to ask me about?
Yeah, I like to say I appreciate the opportunity to participate in this. I know that what we're dealing with on the veterinary side is akin to what's going on the human side, but definitely not to the scale. They're dealing with just so much, such a larger scale of what's going on here, and and huge changes. And I know all my colleagues in veterinary medicine are willing to help out any way we can. We have a website that we share thoughts and education and stuff on, and everybody's talking about, they'd be willing to help out in any way they can, even coming in and helping with patients, because, I think sometimes as veterinarians, we don't get maybe our due as far as what we know as far as as veterinarians, but, in human medicine, things are pretty compartmentalized. But when I'm on the ER floor, I'm the generalist, I'm the anesthesiologist, I'm the surgeon, I'm the internist, and the infectious disease specialist. And, those have value in a crisis like this. And whatever, I know colleagues that I've talked to, we're all willing to step up and help out in just whatever way we need to. So.
Well, you don't have to, as a family doctor, you don't have to tell me about what I think the unrecognized value of generalists is.
Yeah, that's what we are.
And I've only got one species I have to know about. So, I understand and I appreciate that.
Well, but the depth of knowledge that human doctors have of the human body, and I mean, and that's why specialization is so good. I mean, you go to that orthopedic surgeon, and they may only be focused on one joint. It's like, I do hips and knees, or I just do hips, or I do wrists, and it's like, but you talk about somebody who knows their stuff and can do the best for you. And we're getting that way in veterinary medicine. We have orthopedic surgeons and ophthalmologists and all that. But and we have the journalists, and which I think you and I share that love for that ability to do it all. It's like the old GP, they used to do house calls, and they were the one that did the suturing and set the broken bones, and treated the diabetes and everything else. And I think that is the love of medicine that we share. So
yes, and the perspective from seeing more than just the knee joint, for example. Yeah.
I'm like you. I think I'd get tired of looking at knees all day.
Yeah.
Like at some point in time, it's like, can I do it like a diabetic or something? I need something. Maybe it's my ADP or something.
How about an elbow for a change?
Yeah, exactly. Let's do something. So, but no, I appreciate the time, Mark. I really appreciate being able to participate. I know I and my colleagues share the compassion and empathy for our counterparts in human medicine, and we're here ready to help out any way we can. So,
well, I appreciate that, and I hope you find a way. I haven't found a way, by the way. As an old retired guy, and having been on the front lines, I sort of miss it.
Yeah.
Being cheek by jowl with my comrades in the trenches, but we do what we can.
Well, and I know, and I got a son that's an EMT, and he's trying to get a job. He's waiting to hear back, and he's like, "Gosh, they have part-time jobs." And I said, "Yeah, I bet they do." And they're just so overwhelmed with everything right now that whole process is so but it's challenging times, but I believe in humanity and our ability to rise above it. My grandpa was at Camp Funston in World War I, where the outbreak of Spanish flu,
which they say started where in Kansas or Iowa, probably.
It started in Kansas, Camp Funston, where my grandpa was, and they lived through that. And I actually asked my grandma before she passed away if she remembers much about it. She said, "No, not really. Everybody was getting sick, and we just kept ourselves clean." And it's like, they went through it, but they didn't have the ability or the scientific knowledge at that time that we have now to do something about it. So it's like, maybe it is better just to not say anything if you can't do anything.
That's right.
Yeah, at this point in time, it's like we have so much ability to determine our people are humbled when they're saying, wow, this is out of our control. There's nothing we can do about it. And we can't get a vaccine tomorrow. What the heck? We get everything tomorrow. Can't we just go through
Yeah.
Wendy's drive-through?
Doesn't Amazon have one?
Yeah, doesn't Amazon have vaccine?
What, okay, so as a parting note, I just wanted to point out that with that old windmill behind you, that when you get your head just right, it looks like rays of light are shooting
Oh.
out your head.
Well, I'm flattered. I don't think I have that aura really, but yeah, I guess I didn't realize that.
Yeah.
It's like I might have feathers like a big old turkey. But
A turkey, yeah.
that's probably more appropriate.
Right.
Well, Mark, I appreciate this opportunity, and I know you got more of these to do. So, you know.
And I appreciate your time, Ted, and your heart. Thank you.